Hey, welcome to Physio Advice. I'm Chris. Today we're going to be talking about how to fix TMJ pain or dysfunction. So essentially, we're going to start off by talking about what it is. We're going to get into a self-release of your lateral pterygoid, which is one of the main dysfunctional muscles with TMJ pain. And then we're going to talk about the Rocabado 6 exercises. So 6 exercises that you can start doing immediately to help with your jaw pain. Now let's talk a bit about what TMJ pain is. Now TMJ just means the joint, the mouth joint or the temporal mandibular joint. The joint which is between your jawbone and your skull bone. And we use this joint whenever we're chewing, talking, laughing, singing. So it makes sense that this joint can become dysfunctional. Now when we're talking about a self-release, we want to release the lateral pterygoid. This is one of the main muscles that helps with opening our mouth. And it can be quite dysfunctional with individuals that get TMJ pain. So to release this muscle, what you're going to be doing is placing your finger on top of your molars and sliding it all the way to the back of your mouth. Once you're at the back of the molars and you're falling just off the back side of the molars, you're going to be taking your pad of your finger and turning it upwards so that it's facing your opposite eye. You should be able to palpate or feel a muscle there. To make sure you're in the right area, slowly open your mouth. You should feel this muscle expanding into your finger. You can do it a few times, moving your finger slightly each time till you feel like you're in the right place. Now that you know that you're on the right muscle, you're going to be adding some pressure with your finger and holding that pressure for 1 minute. After a minute has passed, you can let off. You should notice that there's a little bit less tenderness on this muscle and it's a little bit easier to open and close your mouth. Now that we've done a self-release of the lateral pterygoid, let's get into the Rocabado 6 program. Now these are 6 exercises for your jaw that you should be completing 6 times, and you want to do them 6 times a day. So the first one is just finding the resting position of your tongue. You're going to be placing 1/3 of your tongue at the roof of your mouth, just behind your teeth. In this position, you can make a clucking sound 6 times. Now that you've found the resting position of the tongue, we're going to be doing a controlled opening exercise. So while maintaining contact with your tongue and the roof of your mouth, you're going to slowly and in a controlled manner open your mouth, open and shut 6 times. There should be no pain with this motion. Next, we're going to be doing isometric contractions of the jaw. So getting your tongue in the resting position again, you're going to resist opening your mouth, holding this for 6 seconds. Next, you're going to resist side translation of your mouth, holding again for 6 seconds. And lastly, you're going to resist side translation to the opposite direction, holding for 6 seconds. The next exercise is stabilized neck flexion. So you're going to be interlocking your fingers, placing them behind your neck, and you're going to slowly nod your head about 15 degrees forwards and backwards. You should feel a light stretch at the base of your skull. The 5th exercise is doing chin tucks. So in a good posture, you're going to tuck your chin slightly, thinking of making a double chin, or the same motion you would make if someone's talking too close to your face, where you slightly retract your head backwards. And then the last exercise is shoulder blade retractions. So in a nice posture again, you're going to be squeezing your shoulder blades backwards, holding for 6 seconds, and repeating again 6 repetitions. As always, this video is just for informational purposes, so if you are having some TMJ pain or dysfunction, it's always best to go see your family doctor, your physio, your chiro, whoever, and get it properly assessed and treated. But hopefully you learned something about your TMJ today, and you learned some new exercises. As always, make sure you like and subscribe, and thank you very much for watching.